Newborn Sleep Patterns is brought to you by Huggies Calming Touch Bath and Body Products. Let the calming scent of lavender and chamomile baby wash, lotion, and disposable washcloths fill the air to help calm and soothe your baby at bath and bedtime.
Here are some tips that I learned to get my baby on a good sleep routine without losing my mind in the process. There is nothing sweeter than a sleeping baby. Newborns sleep a lot, 12 to 20 hours a day, and often in 1 or 2 hour stretches at a time during the first few weeks of life. The result? Lots of sleep for baby and a very irregular and tiring schedule for you. Although there is no real pattern at first because every baby is different, eventually, as his nervous system matures, your baby will get on a schedule and go longer between feedings. By age 3 months, many babies shift more of their sleep to nighttime, averaging 5 to 8 hours during the night. By 6 months, a typical baby may be sleeping 8 to 10 hours straight. Set up your baby's nursery much like you would your own room, quiet, dark, and cool. Most adults prefer it that way, and so do babies.
Adults sleep better if it's quiet, so try not to have unnecessary noise, or if the noise is not that easy to control, you can put white noise in the baby's room. Turn the lights off. If you have to have a night light, why not have it in the hall so that when you open the door, the room lights up, and when you close the door, it darkens, and keep it cool.
Other tried and true ways to get your baby to sleep tight: create a bedtime routine that's calm and relaxing. Start by giving your baby a soothing bath, followed by a massage using lotions that contain calming fragrances. You'll find this is a wonderful way to help your baby relax and enjoy one-on-one time with you. After you've gotten him into his sleeper and fed him, take time for cuddling and rocking your newborn. Read him a bedtime story or sing him a lullaby. When he's nice and quiet, give him a kiss goodnight and put him down when he's awake but tired. Don't put him to sleep in your arms or at the breast.
If you learn to put babies to bed awake but drowsy, they will come to associate being placed in the bassinet or being placed in a crib with making some cuddling and cooing noises, often lasting, from our research, sometimes 3 to 5 minutes, maybe a little bit more, and then they go to sleep.
Very few babies fall asleep instantly, so be patient. Don't put your baby to bed with a bottle in his mouth. This could cause breathing difficulties and eventually lead to serious tooth decay in infants. What's also very important, always lay your baby down to sleep on their back. This is the strong recommendation of the American Academy of Pediatrics in preventing sudden infant death syndrome, known as SIDS. SIDS is the leading cause of death in infants during the first year of life. To reduce your baby's risk, the AAP also recommends using a firm surface for sleep with no soft objects under your baby. Make sure the room where your baby is sleeping is not overheated. Pacifiers may also help. Several studies suggest pacifier use may significantly reduce the risk of SIDS. However, the AAP recommends if you're breastfeeding, wait until the baby is 1 month old so breastfeeding can be established. If you're a smoker, it's time to quit. The American Academy of Pediatrics says smoking doubles a baby's risk of SIDS. And if you bring your baby into your bed for feeding or comfort, return them to their cribs or bassinets when they are sleepy.
The problem with the baby being in the bed with mom is mom rolling over on the baby and suffocating the baby. And people say that isn't going to happen to me. It happens to people. Babies should not be sleeping in the same bed with their mom, with their dad, but they can be very close to them.
To ease your newborn sleep worries, use a baby monitor next to the crib. What really gets nerve-wracking is when your baby gets their days and nights mixed up, snoozing all day and awake at night. To help avoid a long history of nighttime turmoil, don't make those 2 a.m. feedings an event.
Get the baby, you breastfeed the baby, you don't turn on the light, you don't talk to them, you change the diaper quietly in near dark conditions, put them back. If you want to stimulate them during the day.
Whatever routine works for your family is fine as long as you do it in the same order and at the same time every night of the week, including weekends. A consistent routine will help your baby fall asleep more easily, which also means much more needed rest for you.
For more information on newborn sleep patterns, just visit our website at www.forbaby.com. Child care experts recommend all parents should be prepared to give life-saving care to their baby. To locate an infant CPR and first aid training class in your area, go to www.forbaby.com and click on the red heart.